So let's talk about multiple sclerosis, or MS as most people call it. At its core, it's a disease where your central nervous system starts attacking the insulation around your nerve fibers. Think of it like what happens when the coating on an electrical wire gets damaged. The wire starts to short circuit, right? Same thing happens in MS when that protective coating, we call it myelin, breaks down, your nerves essentially start misfiring. And here's the tricky part. This can happen pretty much anywhere in your brain, brainstem, or spinal cord. Where the damage occurs determines what symptoms you'll see. That's why MS looks so different from person to person. One patient might struggle with walking because the nerves controlling their leg muscles are affected, while another might have severe balance issues because their cerebellum took the hit. Most MS patients actually deal with multiple symptoms at once. Since the disease tends to cause damage in several areas simultaneously, now for the good news, and this is what gets me excited about what we're doing in neurorehabilitation today. Research has shown us that many of these disabilities and impairments aren't permanent. Function can be improved, sometimes dramatically. One of the most promising developments I've seen is the use of non-invasive brain stimulation techniques. These approaches can genuinely speed up recovery and enhance the whole rehabilitation process. We're not just managing symptoms anymore, we're actively helping the nervous system rewire and compensate in ways we couldn't even imagine a decade ago. Here we see one of our MS patients suffering from weakness and dyssynergy in his legs.
Okay.
See if you can, almost like you're swimming with your legs. Try and move them.
Notice the deficits in both strength and coordinated movement. Next, we will apply transspinal high-voltage galvanic stimulation. Studies suggest that this type of neuromodulation may enhance motor output or strength and also normalize spinal cord reflexes that coordinate the muscles that move the legs.
Your legs like we did when at first. See?
Alright, okay. And you want me to just lift them straight up?
Yeah, try not to bend your knee. Just lift them off the tables.
Okay.
Do they feel easier to move?
You know it does, since I'm getting going. Am I lifting them correct?
Yeah.
Oh, okay. Yes.
Yeah.
Here we see the patient early on. Notice the weakness and dyssynergy in his right leg. We stacked spinal cord stimulation, whole body vibration, and cross-crawl central pattern generator exercises. Now look at his right leg. That concludes our discussion for today. I hope you found this information valuable for your clinical practice. Thank you for your attention, and I wish you continued success in your work with patients. I hope to see you again at a future lecture.